Good afternoon, everyone, and thank you for joining us today for our webinar. Our topic today is budgeting for HIPAA and cybersecurity. Our goal today is that we can give you some basic budgeting ideas if you do not currently have a budget in place, or supplement what budgets you already do have in place for your organization. You will see on your screen a Q&A pod to the right. Please feel free to put any questions you may have for the presentation, and we will answer those at the end. Also, there is a downloads pod that you will see to the left of your screen. There are some sample Excel budget there, as well as the slides from today's presentation that you can download and use as you would like. Your presentation today will be brought to you by Kathy Bryant and Cassie Turner. I'm Cassie Turner, and I'm a Senior Risk Management Representative at TMLT. I also work with Kathy to provide HIPAA resources to folks, and we also do risk assessments and work together on HIPAA topics. Our disclaimer today is here for you. Just a reminder that this is not any type of legal advice. We just put this here for you to take a brief look at. And at this point, I will turn it over to Kathy to start us off. Kathy, I think you may be muted.
Our goal today is to enhance your understanding of how you can bring HIPAA and cybersecurity into the budget process. We know every medical practice has an individual approach to the process of developing their own budgets, and we're not here today to tell you how you should or should not do your budgets. Instead, we're going to be talking in generalities, hopefully stimulating your thought processes with ideas and strategies for incorporating cybersecurity and HIPAA into your budget.
And before we get started, we're going to put forth a polling question here. If you all don't mind taking a moment to put your answer, do you budget time and money for HIPAA compliance within your organization? And we'll give you guys an opportunity here to submit yes or no. Okay, it looks like quite a few of you do have some time that you set aside for budget and compliance, and some of you not quite yet. So hopefully this material will be helpful for everyone going forward.
So what we're pulling up now is a typical medical office budget. The numbers aren't important because obviously each individual office is going to be different. But what is important is to note, here's the income, and there's only typically a couple of line items under income. And under expenses, there are a lot more items under expenses. But where do you see HIPAA and or cybersecurity? It's often not listed, and even if it is there, it may be buried deep inside your budget. So when you think about your budget, you may think, oh, I've got to pay the EHR. Is that the, as far as the amount we pay on a monthly or an annual basis, for access to our EHR. Maybe it is you have an IT consultant or a managed service provider that you pay monthly or on a regular scheduled basis. You may even anticipate needing to replace equipment. But that's only the very tip of the iceberg. What about things like the cost of doing an annual or every 2-year risk assessment? And once you've done the risk assessment, there are generally costs associated with development and implementation of the risk management plan to mitigate the issues identified in the risk assessment. Do you budget for privacy and security officer training? What about your general workforce training, your new hires, and ongoing education for current employees, both in general on HIPAA and the required ongoing security awareness training? And have you ever thought about what the cost of policy and procedure development and/or maintenance is? You have to have a current basis of knowledge so that you're able to keep your policies and procedures up to date. 78%. 78% actually represents the amount or the percentage of healthcare cybersecurity spending that is spent on technology. Compare that to 68%, which is the percentage of breaches that are caused by employee behavior and not technology. So if you think about it, we're spending the majority of our dollars on something, technology, that's not causing our breaches. In fact, only about 1% of healthcare cybersecurity investments are being spent on the areas that cause the majority of breaches, those caused by employees. So we want to look at the HIPAA rules as a framework for you to use for budgeting. It's going to be a very high-level, quick review of some of the major components of the 3 rules. Just last week, I heard Roger Savino, the director of the OCR, who is responsible for HIPAA enforcement, speak. One of the things that he stressed that really struck home in thinking about the HIPAA security rule is that HIPAA should be considered the floor of compliance, not the ceiling. Meaning you can be meeting every single component of the HIPAA security rule and still suffer a cyber attack. So even though we're going to talk about budgeting from this framework, just keep in mind that there are lots of additional things that could be added. Within each of the rules, some obvious and somewhat more embedded are the administrative requirements, the physical requirements, and the technical requirements. Of course, these specific safeguards are called out by these names in the security rule. So when you think about developing your budget, you need to start thinking about it like maybe a jigsaw puzzle. It's kind of pulling all the things together about your organization. How big is your organization? What's the culture in your organization? Are there specific unique factors about your organization? Do your employees specifically know what HIPAA is, and are they committed to preserving the patient's rights under HIPAA? And generally speaking, are you a reactive practice versus a proactive practice. These are just some of the basic things to think about as we get started. So with these general concepts in mind, let's take a look at how we might develop a budget for the privacy rule. Some of the major components of the privacy rule are the notice of privacy practice, the use and disclosure of protected health information, the patient's rights under privacy, and all of the administrative responsibilities that a practice must meet. We've actually provided a spreadsheet as the second attachment, downloadable attachment for today's presentation. In that, you're going to see a spreadsheet that is fully, has all the formulas built in, and you can actually use it as a basis if you want to for developing your own budget. Under the HIPAA privacy rule, for instance, how much time, which translates into salary, are you allocating for your privacy officer? What about the notice of privacy practice? Let's look at that in a little more detail. So if you're going to review your notice of privacy practice and perhaps have to develop a new one, let's say a manager spends an hour on review. They spend 2 hours when they determine that it's not meeting all the current requirements. Then you have to educate your workforce on that new notice of privacy practice. And then for all your new patients next year, you're going to have to print copies potentially and distribute them. So the cost could be, as in our example here, $137.50 just to review and update your notice of privacy practice. But there might be other costs. If you have a website, your notice of privacy practice must be on the website. So what is the cost that your web developer is going to charge you to update your website? When we think about the HIPAA security rule, as we said, it is neatly broken down into the administrative, technical, and physical safeguards that we talked about earlier. On the administrative safeguards, you have things like the risk analysis or security risk assessment. You have to know how to handle security incidents, as well as things like simply the salary allocated to your security officer. Physical safeguards. These may all be in place in your organization, or perhaps you did a risk assessment this year and you noticed that one of the findings was that you had an opportunity to increase your physical security. And maybe you're going to install electronic locks with card readers or fobs. Some of those locks start at about $1,000 per lock. So you may actually be looking at substantial investments in things like this, for physical security. Things like an alarm system or cameras. Those are things that may have an ongoing cost on a monthly basis. Technical safeguards are where, generally speaking, that 78% of spending that we talked about earlier goes. It's all the things that you're paying for to maintain your network. It's things like your firewalls, your routers, maybe you're paying for phishing campaigns, penetration testing, vulnerability testing. Some of these things can be quite expensive. Again, it may be something relatively simple, like encryption. Your portable devices may not be encrypted. So that may include additional software as well as IT time to encrypt all your mobile devices. Technology is changing very rapidly. Historically, healthcare has not kept pace with technology as well as other industries. We say that if you're using the same the same security framework today that you were using 3 years ago, it's like you've arrived at a gunfight with a bow and arrow. We know the cyber criminals work 24 hours a day, 7 days a week, trying to figure out the best way, or the next best way, I should say, to get into our networks. And so we have to stay at least in step with them. I'm not sure we can ever get ahead of them. If you've heard me speak before, I often use this in presentations. Do not use the B word, breach, unless you have to, because all breaches of unsecured data are reportable. That's reportable to the patient, reportable to the federal government, Health and Human Services, and potentially reportable to the media. But you are required to have a breach notification policy. It has to be written. You must educate your staff on the policy. You should have a quick response team, and you should notify, that should include notifying your cyber insurance provider in the circumstances when you have a privacy or security incident to help determine if a breach has occurred and if notification is required. This is one policy you want to be very proactive and have in place, because waiting until something happens is too late. You need to know, and your staff need to know immediately what to do if an incident occurs. So some of the things to think about are, if you do not have a breach notification policy and procedure, what's it going to cost to actually develop one? What would it cost if you decided to do an internal investigation on your own and didn't report an incident to your cyber insurance carrier? What's the cost of notifying patients, as well as the cost of media notification? So if you think about, do you and your staff know how you would respond if you had an incident, and what kind of cost that would actually amount to? The cost of a breach reported in the media is quite high. If you look at the root cause, the second section of the slide, if a breach occurred in healthcare due to a malicious or criminal attack, the cost was about $156 per record. How many records do you think you have in your EHR or your practice management system? Do you have a legacy system that's still online, one that you're not using anymore, but those records are still sitting out there and potentially subject to a breach? You may have a server that's in your server room with all these records on it that is a potential risk to you if it is still connected to the server. But let's just imagine that you have 1,000 records in your database, which is actually a pretty low record or amount. So the data breaches are, that would be $126 to $156 per record times 1,000. That adds up really quickly as far as the cost of breaches. And breaches are far more expensive in the U.S. than they are compared to other countries.
So as we look at some of the items that Kathy has outlined, what obstacles do you all face when you're budgeting for HIPAA and cybersecurity? We'll give you guys a minute for this polling question. Do you guys feel you're too small, or you pay for a cloud-based DHR and that's all you need? Do you not budget for training of staff? Do you depend on your IT folks to help you, or do you feel that you're exempt from HIPAA requirements? Or if there are other obstacles you have, please feel free to type them in the chat box below so that we can take a look at those as well. So a couple of responses here, Kathy. Some not budgeting, some depending on their IT vendor, which is common, to help.
Well, that sounds like, many of the typical responses we get when we have conversations with practices. So I think it's real important that you think about this question as you're starting to do your budgeting, because ultimately all of these reasons of why not to may help you develop a stronger argument for why you need to. We always like to think about what are the risks if you do not create an adequate budget for HIPAA and cybersecurity. The risks always include the potential for an investigation by the Secretary of Health and Human Services. That could be because someone complains to HHS about what they perceive as a privacy or security incident at your organization. Or it could be because you had to report a breach. There are always potential fines and penalties for failure to comply with HIPAA. And then the reputational harm is, again, always a huge possibility. Are patients going to continue to want to come to your practice if you've had a publicly reported breach, maybe in the media? Earlier this month, Elite Dental Practice in Dallas, Texas, agreed to pay the federal government $10,000 for inappropriately disclosing PHI when the practice responded to a negative review on Yelp. One of the issues that the OCR stated in their report was that they found this was not the first time that this had happened, and that social media is not a place for providers to discuss patient care. Doctors and dentists must think carefully about patient privacy before responding to online reviews. In fact, in addition to the fine, the practice was required to develop policies and procedures that had to be written, approved, and then staff training implemented. They needed to update their notice of privacy practices. They have to report ongoing privacy and security incidents to the OCR, and they have to do annual reporting for 6 years to the OCR. Surveys show us that 75% of healthcare organizations are going to increase their spending on cybersecurity next year. The numbers are pretty staggering. Between 2010 and 2018, spending on cybersecurity in healthcare actually increased 141%. So where are you going to spend your money or budget your money for next year? We want you to think back to the privacy, the security, and the breach notification rules. But also think about it in terms of your people, your technology, and your processes. An example of this would be, what if your risk assessment showed that your antivirus software was not being kept up to date? Is it a people issue? Have you given your individual users administrative access and they turn off the updates because they don't like their work interrupted in the middle of the day for the updates? Is it a technology issue? Perhaps the antivirus software that you're using just isn't adequate for your organization. Or maybe it's a process issue. Maybe your organization is so large or large enough that you need to consider having a managed service provider to actually assure that this requirement is being met. Hopefully today we've planted some seeds of success, strategy, or solutions. At least maybe we help to set a goal of budgeting for HIPAA and cybersecurity. But let's take a look back and kind of summarize the process. Hopefully you will be able to develop a plan for compliance and cybersecurity. That plan should include allocating time each month for your privacy and security officer. Most experts agree in small organizations it probably needs to be 8 hours per month. What equipment do you have that's getting older? What have you spent in previous years? And what operating systems are you using? Microsoft in particular is famous for doing what they call end of life of their equipment and their operating systems. And both some of their server software and their operating systems are going to be end of life in January of 2020. Network infrastructure is some of those bigger pieces when it comes to IT, like upgrading servers if you have them in your practice. Are you scheduling training for your workforce and privacy and security officers? And don't be afraid to ask for help. You can certainly reach out to TMLT through our consulting at TMLT web or email, or calling us at any time. Because sometimes actually soliciting help from a consultant is actually less expensive than trying to figure it out on your own. We want to thank you for attending today's webinar. Remember that the slides and additional reference material are available for download, and you will be receiving a link tomorrow with a link to the recorded webinar. We'd like to take questions at this time. If you would have any, please feel free to type them into the Q&A pod on the right-hand side. While we're waiting to see if any questions come up, I wanted to share with you all a little bit about the TMLT Resource Hub. We've had resources on our website for many years, but it's been reorganized into a resource hub available at www.hub.tmlt.org. Particularly, I wanted to focus on the fact that now all of our webinars and podcasts are available after they are recorded directly on this site. Don't see any questions coming in. Do you, Cassie?
No, I don't, Kathy. If you do have a question, oh, I think I see a question. Can't get the Hub TMLT website to work.
If that's not working, go to just tmlt.org, and then one of the tabs at the top is the Resource Hub, and that will get you to the hub. I may have typed something wrong in that address. We're being told don't type the www. It might be your browser if you're typing that in.
Right.
We want to be sure and invite you to join us next month when we're going to talk about auditing information systems activities. This is one of the very hot topics that we are seeing when the OCR is investigating ransom attacks and other types of hacking incidents affecting practices when they have had to report a breach. So that may be something that you may or may not be doing on a routine basis, and we'd like to bring you some insight on that topic. Just a reminder, if you have questions after the webinar, feel free to email them at consulting@tmlt.org. Thanks and have a great afternoon.